depending on, because of COVID. So this was a case of a colon cancer. It's an ascending circumferential mass here. You can see, but it looks like it's going beyond the wall of the colon, and it's even thickening the lateral conal fascia here. So this was, and there were some tiny lymph nodes in the area. But this is probably a T4 tumor because it's going beyond the serissa. And normally this would be considered a high-risk colon cancer. And normally this would go straight to surgery. But in the era of COVID, they're actually doing a lot more preoperative chemo and even radiation because they're trying to stall patients for at least 4 weeks so that they can preserve, PPE and anesthesiologists. So the discussion we had at Tumor Board was this, for example, a T4 colon cancer are ones that are perforated, that invade the serosa or the peritoneal lining, which is on the serosa of the anterior and lateral ascending and descending colon, and on the transverse and sigmoid colon, or if it's directly invading adjacent structures. And the SSO basically has sent out revised guidelines for surgery for a number of cancers: esophageal, gastric, colon, pancreatic, etc. So you can go on the SSO website. They just released it a few days ago. And so they're saying, like, defer surgery for polyps or early stage disease, operate if obstructed. Where this comes into play, this case, for example, was normally they go straight to surgery, but in this case, it says consider neoadjuvant chemo for locally advanced colon cancer. So we're still discussing these at tumor boards, and they're just triaging them into a different protocol because of, and for example, they're also delaying rectal surgery for 12 to 16 weeks, and we're utilizing more radiotherapy for locally advanced rectal cancer.
So we had the same discussion this morning in our rectal cancer conference, delaying surgeries, doing more chemo instead. And I think there was an American College of Surgery webinar this morning at 8 o'clock Central, which I didn't actually get a chance to watch, but I think their material is online, so I intend on looking at that.